Throughout the United States, it has been discussed about the lack of diversity in the quality of VA healthcare. But very little discussion or agreement occurs. On April 28, 2016, Congress introduced the Care Veterans Deserve Act, stating veterans could seek medical care outside the VA. But this only made wait times longer for most patients. Most veterans, like Gary Hanna, tend to file multiple claims with the VA for medical care but often get denied or put on a longer wait list. Almost all conditions ignored are life-threatening.
Next week, 2 weeks later, I fell and broke my left shoulder, and they're still turning me down for my neuropathy, and I've got it bad.
In a POGO study conducted, approximately 35 out of the 50 states report problems with the VA healthcare system.
I've been waiting to be assigned a primary care doctor since September. These guys need health care now, not months out, not even weeks out at times.
In a study conducted by Hamilton, Frayne, Carrasco, and Washington, they gathered data from an analytical perspective as to why most veterans stop seeking medical attention from the VA.
They need more staffing, doctors, nurses.
He says too many veterans are waiting for care, and their health may be at risk.
It needs to be expediently, now, not later.
By advocating for veterans to seek a higher level of education, they can obtain medical degrees to become doctors, nurses, physicians, etc., to enable veterans to care for other veterans.
The Pat Tillman Foundation invests in military veterans and their spouses through academic scholarships, building a diverse community of leaders and committed to serve others.
The GI Bill provides up to 36 months of educational benefits, generally payable for 15 years following one's release from active duty. Institutions of higher learning participate in the Yellow Ribbon program, which makes additional funds available such as monthly housing allowance, annual books and supplies stipend, and lastly, one-time rural benefits payments.
I'm probably going to pay dearly for this because I'm one of those veterans, okay? I've got a 50% disabled rating.
Lieutenant Colonel Oliver North is a veteran of the U.S. Army that encounters the daily struggles that most patients experience at the VA. Lieutenant Colonel North chooses to become an advocate for these veterans to get them to have more benefits and have efficient medical care.
There's simple solution to what's happening in the VA is that
Lieutenant Colonel Oliver North advocates for veterans helping veterans by having the retired or fired staff replaced with the patients that attend the VA. By finding scholarships for veterans, we can get most patients to obtain a medical degree to work for the VA and get other veterans faster medical care.
What to do? Every time there's a person who retires or gets fired out of the VA, hire vets first. Veterans will take care of each other. Veterans care about one another.
If the audience is aware of the lack of diversity in the VA healthcare system, then they can talk to loved ones or family members that were once active duty. By informing veterans about the scholarships that are available to them to seek a higher education in the field of nursing, pharmacy, physician, etc., then we can ensure that the audience is helping to improve the diversity in the VA and get most combat veterans to help other veterans.